Okay, welcome everybody. I hope you can introduce yourselves, please, using the discussion forum, and please state where you're from, introduce yourself and where you're from. You'll see we've got a live poll, and we're really excited if you can enjoy yourself today in this session and engage in the polls that we'll be running. So the title of our session is To Walk Before You Can Run, ensuring global health systems research questions are informed by stakeholders in the context concerned. And while you're all joining, I just wanted to show you our exciting lineup. We've got Professor Dame Anne Mills, who'll be chairing our session, and 8 speakers from our Active Development Awards who will be telling you about their experiences. And Val Schnuin will be starting the session from the Department of Health, who will be talking about about the Department of Health and how we established the Global Health Policy Systems Research Programme. So let me introduce myself. I'm going to be moderator. I'm Sarah Puddicombe. I'm the Assistant Director for the NIHR Global Health Research Programmes, which are based at one of the centres that manage these programmes on behalf of the department, the NIHR Evaluation Trials and Studies Coordinating Centre. And we're responsible for managing not only global health policy and systems research programmes, but also the NIHR Global Health Research units and groups. And as you may be aware, all of this is funded using official development assistance funding through the Department of Health. And it's with my great pleasure that we have Professor Dame Anne Mills, who will be chairing our panel discussion this afternoon. And she, as you may well know, is Deputy Director and Provost at the London School of Hygiene and Tropical Medicine. She's not only a Professor of Health Economics and Policy, but also our current Chair for the Global Health Policy Systems Research Programme Funding Board, and a worldwide authority on health economics, and particularly with a focus on efficient health systems in low middle income countries. Now, I'm just going to continue with the welcomes, but a little bit of housekeeping and run through the agenda for our session today. As I mentioned, Val will be talking through the NIHR Global Health Research Programme, how it was set up and the aims of our development awards. We'll then move to a panel session chaired by Anne, with presentations from 4 of our development award holders, one from based in the NLMIC country and one from the UK. We will then have a brief question and answer session after each presentation, and then move to an open panel discussion with question and answers. So please do engage in that. We're really looking forward to a lively and interesting debate. And then I'll finish the session with a very brief summary and some concluding comments and some of the opportunities that will be forthcoming in NIHR. So just as a matter of housekeeping, if you're having trouble with your system, please use the live support function. I do encourage you to use the live question and answer for the panel questions, but in the meantime, please can you use the discussion forum to introduce yourselves and to make any sort of comments or sort of general chat. So moving on, I've run a poll here fantastic that most of you have a good moderate experience, but some of you have limited experience. I'm going to leave that poll running for a little while. But before I move on to Val, I'd just like to encourage you to answer the next couple of polls, which are, when you're planning research proposal in low resource settings, what aspects do you actually think about doing first? And secondly, when you're thinking about community participation, what are the main barriers to priority setting and needs assessment in low resource settings? So I'm going to leave those running, so please engage in those. And I'm going to move on to introduce Dr. Val Schnuin, who's Head of Global Health Research Partnerships at the Department of Health and Social Care, and really very much focused on addressing unmet need in applied health research and training for the direct and primary benefit of people in low middle income countries. And as you see, Val has a background with a PhD and postdoctoral research background in tuberculosis and malaria. So Val, I'm going to move over to you, start my video.
Thank you very much, Sarah. Thanks very much for the introduction. As Sarah said, I'm Val Snewen. I'm Head of Global Health Research Partnerships in the Department of Health and Social Care, and I thought I should just explain to this audience that that's a government department equivalent to the Ministry of Health in the UK. So I have just 4 slides to set the scene before we get on to the real content of the session, which is to hear from the speakers themselves. And the first slide here hopefully just explains the Department of Health and Social Care and the National Institute for Health Research. So on the left-hand box, it really just explains that the NIHR, which is the National Institute of Health Research, funds applied health research, and the primary aim until we came along as a global health research programme was to fund health research, social care and policy research, much of which underpins the NHS, the National Health System in the UK. And so from government budgeting in 2015, a new programme of global health research was established. And as Sarah mentioned, that budget comes from the aid budget, the UK aid budget, which is Official Development Assistance, ODA. And so the primary and direct benefit of all of that funding is people living in countries on the DAC list, as they call it, the Development Assistance Committee list, which throughout this talk, I'll talk about low and middle income countries. And those categories are as defined by the World Bank economic categories. So next slide, please, Sarah. There may be a little delay, so please bear with us. So I thought we'd just set the scene really to say that so since we are quite a new programme, and with the history of NIHR in particular and the links to health systems research from knowing the UK context, you would not be surprised to say that looking at the global health landscape, we were particularly interested in scoping where the unmet need is and what the possible role would be for our programme in this area. And those of you who might remember those happy days when we could all meet face-to-face at conferences in the Liverpool version of this meeting a couple of years ago now might have joined our session, which we ran as the start of that process really. And following that session, as shown here in the left-hand side of the slide, we followed up because actually it opened up more questions as well as some answers. We followed up with a survey of researchers and some interviews. We then established a community of practice with researchers in various contexts around the world to test some of the ideas that we were getting and some of the models we were looking at. And we came up with one suite of activities, which we call the NIHR Global Health Policy and Systems Research Programme. And underneath that programme, there are 3 different calls or 3 different types of funding opportunity. The right-hand box summarises a few of the key findings that came out of that whole process, which took more than a year or so of activity. And in particular, the development awards, we're really interested in that question of how do funders provide an opportunity for what I've called here new entrants. We don't really have a good descriptor for it, but for people to get into this area and in particular develop partnerships if they don't already have them, and develop research programs that really address the needs of people in the settings that they're interested in looking at. So how can we help facilitate that? So next slide, please. So we came up with the 3 activities underneath our one global HBSR program, as we call it. And this session is really only going to look at the development awards, which are summarised here, but we thought it would be helpful to give you the context. Some of you may know these and some may not. The development awards, we have 17 of those now ongoing. And the aim is as stated here, for us, they're really quite unique in that they are planning awards. Mostly research funders fund research and expect people to dive straight in and get on with the research. The aim here was really to address the issues we heard in that consultation process and provide an opportunity for those relationships to be established, and in particular for partnerships to be developed, networks of researchers, and also to really look at the context where the need is and address those questions, rather than thinking about what research we want to conduct. Think about what research is needed in the settings concerned. So next slide, please. And so the elements that we came up with for the development awards are the 5 key points here, listed A to E. And yes, partnership development. To come in for one of these awards, you had to just have 2 people, really, two leads, one from an ODA eligible country, so a low middle income country, and one from a UK institution. And then the aim is that the award enables the building of a wider group of researchers to bring in other people that maybe you've never worked with before. So B here is reviewing the local context, and you might be surprised how often that is not done in research applications. So that opportunity to really look at what has already been done and what the setting is in the countries concerned. C is the needs assessment, then to look at what the need is. D is looking at plans for research capacity strengthening, both at the institutional and individual level. And then E is looking for a strategy or developing a plan for research uptake dissemination, so that the research once conducted will have impact. So all of those elements come together with the aim of providing the underpinning work that will allow a future application. And as I say, for us as funders, that's quite a novel concept. So next slide, please. I'll stop there because we have an exciting session ahead, and just say thank you very much. I don't think we need any questions from me, because I think I'll pass over directly now to our chair, Professor Anne Mills, who will take us forward for the next, the main part of the session. Thank you.
Thanks very much, Val. And it's a pleasure to chair this session. Thanks for allowing us so much time. We're ahead of our program, and that's really good, because it means not pleased that the presenters can take more time, but that we'll have more time at the end of the session for the Q&A. So as Val said, we're going to start the panel session with the presentations from 4 award holders, who are going to say basically what they've done to date in their awards, accepting that they've been somewhat delayed by COVID to different extents. They've also been asked to reflect on this funding mode of the development award, which is a particular focus of this session, to both reflect on its value and to think about whether it's worked well, whether it could be improved in any way. And there are some particular features that the presenters have been asked to pick up, things like how well the stakeholder interaction has gone and what their plans are for community engagement and building partnerships. And just to mention that in the UK, NIHR has always had a very strong emphasis on patient and public and community engagement, and that's reflected in the scope for these awards. So I think it'll be interesting to hear from the participants about that. So after those 4 presentations, just to alert you to what is coming up after that, we'll have time for the Q&A session. The Q&A will operate by you posting your questions or comments in the Q&A box, and I'll take those once all the panelists have spoken, and we'll put the questions and comments to the panelists. So please, as we go through, please put questions in the box, but also within each of the presentations, each presenter has been asked, or each pair of presenters has been asked to speak for 10 minutes, and we'll have a few minutes after that for any clarification Q&A. So if you have any very specific questions on each presentation as the presenters speak, do put the points in the box, and I'll call for those and pick them up after each talk. In the panel session, just as a taster for what I'd like to get onto in the panel session, I think some of the aims of the NIHR Global Health Policy and Systems Research calls are to support equitable partnerships with low and middle income country leadership, to support approaches which include public, patient and community perspectives in research, to ensure research questions respond to the realities and priorities in low and middle income countries, to support the long-term sustainability and impact of research efforts, and to encourage lesson learning not just within low and middle income countries, but also potentially from those countries back to the UK. So that's just to start stimulating some thoughts about the later discussion. But I want now to start with our group of 4 presentations. Our first pair of speakers are Jean-Paul Dossou from Serud in Benin and Maria Paula Bertone from the Institute of Global Health at Queen Margaret University in Edinburgh in the UK. And their talk is about the political economy of universal health coverage reforms, building capacity engagement of Francophone West Africa. So Jean-Paul, please go ahead.
Thank you, Anne. This is Maria here. I will start with the presentation first and then hand over to Jean-Paul for the concluding slides. I hope you can hear me and you can see my screen.
Yep,
yes,
that's fine.
Great, thank you very much. So thanks again, Anne, for introducing us. As Anne said, my name is Maria Bertone, and sorry, I just got a strange message on my video, but let me know if there are any technical issues. Otherwise, I'm going to present our development award and the project we've been working on, that is the political economy of universal health coverage, building capacity and engagement in Francophone West Africa. And as you see from this slide, we are a consortium which is led by QMU in the UK and Serud in Benin, and we have research partners in Mali, in Burkina Faso, and in Cameroon. The aim of our project is really to develop a strong, effective, and equitable research partnership in line with what Val was saying, our focus is specifically to strengthen capacity for political economy analysis, focus on UHC. And also importantly, we want to engage with stakeholders and community to enable that research that we plan for the future. And our focus, the rationale for focusing on political economy of UHC, is that while we understand there is a global recognition of a priority of universal health coverage also as a SDG, the progress towards UHC is inherently political, and we can see and we can find many political barriers to that, and this is why we think political economy analysis is the best way, or perhaps one of the tools that we need to use in order to engage and shed light onto the barriers and the facilitators of UHC reform. And the 4 countries we work in, there are different stages of UHC reforms, which more or less in each country seems to mean a setting up of some sort of social health insurance scheme. But they all experience delays and challenges that are not only technical, but are really also related to the context where there are, including instability, fragility, conflict in some setting, or political instability, donor dependence, and other issues that are quite strongly related with political economy. So what we have done in terms of our approach for this development award really reflects what Val was saying about the key pillars of this type of award. And we started with building a partnership. Jean-Paul and I reached out to other people that we have partially collaborated with, but this is mostly a completely new collaboration for us. And we had identified and contracted over 3 research partners. And the second pillar concerned the review of the context and of the literature. And here we have conducted a mapping of UHC reforms in each of the country that we are looking at. And also there is an ongoing review of the literature, focusing on how stakeholders were engaged at different stages of research in existing studies of UHC using political economy analysis. And then the last 2 pillars and components of our project focus on capacity strengthening and stakeholder engagement. I'm going to say more of that just in a minute, but just for you to know, these are so important for us. We created 2 internal working groups that with 1 representative for each institution that specifically focus on these 2 pillars. And the aim here is to that all the work that we do on these 4 pillars kind of leads to and builds on what will be the future proposal for research focusing on political economy of UHC, which is grounded on stakeholders' needs for research and their stakeholder engagement. So we are creating also plans and platforms for engaging stakeholder in the long term, as well as the academic output that I was describing. When we look at outcomes, I really want to focus on 2 specific things here. One is the capacity and strengthening I mentioned, and then the stakeholder engagement. In terms of capacity strengthening, we have developed a capacity assessment tool and a capacity strengthening plan that focuses both on individual and institutional levels. And we have really opted for an approach that is quite horizontal and really co-learning together. There is a mix of peer-to-peer learning. We also have guest facilitators or trainers, and there is some sort of mentorship scheme internal to the project that is going on. And we try and make co-decision through the working groups that we have set up. As Anne hinted to, yes, COVID has much affected our project, and so all of the activities we had planned had to be kind of switched to remote and online learning and training, as you can see from the picture there. And you have a list of the training we've already done and the ones that are planned. And also importantly, we had a session before the Christmas break at HSG, this same conference, and a skill building session on doing political economy analysis, reflecting a little bit on the lessons learned so far from our project. And the second key outcomes, again, very important for us, was the stakeholder engagement. This is definitely something important for this type of development award, but also it was quite sensitive for us, given that our focus is political economy, and therefore something that it's really difficult to engage stakeholder in and have them participate in actively, because much of what we say and what we will research on and we do research on is quite sensitive. Our approach initially was to carry out stakeholder meetings. That was not possible due to COVID, of course, so we have opted for in-depth interviews, so bilateral, oftentimes through phone, and we are going to follow up with stakeholder meetings if it's possible, given the COVID developments in Africa. We already had one in Cameroon, and it worked very well. We also try and go beyond the usual actors, the Ministry of Health and the public sector, and trying to include the private sector, the unions, professional boards, civil society, and the media organizations. So going kind of really broadening our audience. And in terms of key outcomes, I think what has been really interesting is to assess the stakeholders' understanding of political economy analysis, what it means for them, how can they use research on political economy analysis, and how can they engage with that? And also harnessing their intuitive understanding of it. You have two quotes and they kind of post it there, where some of the private providers, they say how they actually do use political economy thinking without actually knowing of that. We also provided some sort of practical training on political economy analysis, for example, with the reflective stakeholder mapping, so stakeholder mapping done by stakeholders themselves, that you can see in the top graph in the top figure there. In doing that, we also developed approaches and platform to engage stakeholders on sensitive issues, in particular focusing on needs rather than on interest and position. And we are in the process of defining research needs and co-develop research questions for the future project. I'm going to hand over to Jean-Paul for the next few slides.
Thank you very much. So COVID-19 stakeholder engagement. COVID-19 stakeholder engagement and the dual working language have been three key challenges I would like to discuss a bit here. So about COVID-19, so it has been a challenge for everyone. As Maria was saying, we were forced a little bit to be creative and move from what we have planned to do physically into virtual space. So we have also worked to plan, to review the planning of our activities and adapt that not only in terms of financial aspect, but also in terms of engagement with stakeholders. And about engagement with stakeholders, it is also key to know that stakeholders we are working with here are not only knowledge users and those who have a kind of intuitive knowledge and intuitive sense of political economy analysis already, but they are also our study of subject, and that creates a really specific space for research and for work, and that have quite some implications not only on ethical aspect but also on the nature of the relationship between we as researchers, if we can call in this context ourselves like that, with those actors that are on the field, and that almost on day by day have to solve in one or another way political economy questions and issues, and they have to deal with them, to take action, even though they may lack some structured and systematic tools and approaches to do that. And then we have the dual working language, English and French. To engage with some actors in the region, it has been a key challenge, but it is also part of the learning process for researchers and for the team. In a research center like CIRUT, we are almost at 80% bilingual. This can be a little bit more easy for us, but in other settings, it has been very challenging and not always easy to work with. Next slide, please. So in terms of reflections, it has been clear that the award provided to us a clear and really interesting structure and reliable time frame for founding. And it was an exceptional opportunity for us to develop a set of pillars that can help us really to have a mature proposal. And not only have been raising networks, but building networks and building engagement with potential future users of the product of our result, but also we have been building institutional but also individual capacities and our practice to work together, and that is an exceptional opportunity. We are very grateful for that. It is important for us here in terms of reflection to anchor that what we have been learning so far can be grounded organized around 4 key words. The first key word is that in terms of political economy, the major thing we have to do is to create awareness about the added value of political economy analysis to address complex challenges that people are having in their context. But those challenges, we still have to make them explicit, and the research have to work to make explicit concretely those political economic challenges and make explicit solutions that can be grounded on political economy analysis to address those problems. In one another way, we have to make the case for political economy added value for them in their context so that we can engage them very well. And then we have to support action. So awareness, explicitation, and support action. And at the center of all of those 3 elements, we have to be continuously learning. And for our early career researchers gathered in this platform, it has been a tremendous opportunity. So definitely the co-led working group, the South-South collaboration, the horizontal way and way of collaborating within this research, within this network has been something very important and valuable for all of us, and we are very grateful to that. And this is something we need to voice about and promote in collaboration between the North and the South in future similar research and activities. Thank you very much.
Thank you very much, Jean-Paul and Maria. And that was a really clear presentation. Thank you for that. There's one question that's come in, which is excellent, which I'll take in a moment. But just a comment, first of all, that the sorts of panels I'm involved in health policy and systems research are always wanting political economy proposals. It's a really neglected area. And so I was delighted to see this and very glad it was being profiled first in the list of presentations. And the other really important thing about this proposal, this work, is that in Francophone Africa, and here in the UK, we get relatively few proposals from Francophone Africa. So really good to get that, and excellent, Jean-Paul, that your institute has 80% ability to deal in both languages, because I must say, I'm afraid we rely more on the French speakers to speak English than the English speakers to speak French. Though, Maria, you probably have reasonable French, I would guess.
Yeah, but I was going to say we're not at 80% in our institute, but getting there. We have quite a lot of different languages.
If you have Italian, you can probably stretch to French fairly easily. So we have a question from Tess Green, which is really relevant actually to this development award. What is the best approach to keep stakeholder engagement and deal with the time gap between the end of the development award and the start of a potential new research project? And of course, it is a potential research project because you don't know whether you're going to be successful in the next round. So how do you keep your stakeholders warm, so to speak?
Yeah, I will start attempting an answer and then leave it to Jean-Paul, who has more experience than I have on this. But I think, yes, this is a challenge that we face. And as you said, Anne, I think it's even more because it's political economy. Everything we do, or the type of research we do, it's quite sensitive. So we try and do, because we're putting the base of engagement despite COVID and everything. We are already engaging with them. We're in regular contact with the stakeholders. We're creating this group. We're really aiming to try and bridge the time gap between this award and a potential next, hoping that of course that is achieved, and that we work under that assumption at least. And we have different ideas and different platforms that of course they vary depending on the country, but some ideas include of course face-to-face engagement. That, as long as it's possible, that's the best mean to keep them engaged. And then we also try and offer something in the sense that there is value in the dialogue and in the platform that we create. It's not a one-way communication from researcher to the stakeholders. It's a two-way communication where we can see how things are evolving, what the research needs are in a kind of an evolving context. And thirdly, we are thinking of also online platforms, because these days everything it kind of has moved online. So we're also thinking of online platform, perhaps through a tool, a software, not really a software, but a platform called Collectivity, where people can come together and really work together and share ideas in a virtual environment.
Okay, thank you. Jean-Paul, can you add from a country perspective?
From a country perspective, CERID is operating now on various universal health coverage issues as a kind of hub, whereby we are having several projects running almost jointly on various aspects. So we have other opportunities to keep close contact with various stakeholders, and we have also opportunity to be discussing and raising up the political economic challenges that they are facing. So in one or another way, we are in the context. We have also other opportunities to be having face-to-face and various form of interactions with them around universal health coverage related issues. I think, and this is one of the most powerful of our model, to be able to have in the region an institution that is anchored there and have continuous interactions with stakeholders. And beyond all of that, I think one of the most important points is to showcase of the added value of political economy analysis. It's about really building the case, showing how we can have an added value. And once that is there, they will be also asking for us. And I think we are slowly making that difference.
Excellent. Okay, thanks. So I'm aware that a couple of other very interesting questions have come in, but both of them can be taken as generic to all presentations. So I'm just going to leave them sitting there for the moment because I think we've had our time. Thanks very much, Jean-Paul and Maria. And I'm going to move now to the next presentation, which is by Dce Pilot, who is the program manager for the option program at WIT's Reproductive Health and HIV Institute in South Africa, and Colin Ziwuji, clinical senior lecturer in sexual health and HIV medicine at Brighton and Sussex Medical School in the UK. And their title is Integrating HIV Pre-Exposure Prophylaxis and Diagnostic STI Care, an Individualized Public Health Approach. Thank you. Go ahead. So we can see.
Hi, can you hear me?
Yeah, we can hear you and we can see your slide, Collins. Thank you.
Yeah, my name is Collins. Dce and I will take it in turns to discuss our project. We'd like to thank the conference organizers and the NIHR for the opportunity to present our work. So, introduction. South Africa has the highest number of people living with HIV and sexually transmitted infections globally. Any HIV control initiative must address sexually transmitted infections, as STIs are associated with increased HIV acquisition and transmission. In June 2016, the South African government rolled out HIV pre-exposure prophylaxis to address the HIV incidence, high HIV incidence in key nations. Currently, as of July 2020, there were nearly 88,000 people on HIV pre-exposure prophylaxis across 203 sites. A recent systematic review of 88 studies by the WHO revealed high STI prevalence in people initiating PrEP. 24% had chlamydia, gonorrhea, and/or early syphilis. Additionally, those on PrEP showed a higher incidence of STIs. 21% had chlamydia compared to the global average of 3%. In South Africa, management of STIs is based on the syndromic approach, meaning only those presenting with symptoms of STI are offered treatment. The shortcoming of this approach is that the majority of people with STIs do not have symptoms, hence will not be treated for STIs. Conversely, not everyone with genital symptoms has an STI, resulting in overtreatment, which could potentially fuel antimicrobial resistance. Integrating diagnostic STI care and pre-exposure prophylaxis provides a unique opportunity to reduce both HIV and STI transmission. In our approach, the South African National Strategic Plan for HIV, TB, and STIs aims to reduce new HIV infections and STI. The strategy specifically highlighted the need to exploit point-of-care STI technology and for detection and treatment of STIs, and strengthening STI surveillance, including STI antimicrobial resistance. So to achieve the goals of this strategic plan, investigators at Wits RHI and Brighton and Sussex Medical School established an equitable research partnership through the Development Award to undertake a needs assessment to understand health system requirements and research capacity required for integrating diagnostic STI care with PrEP provision. Investigators at Wits RHI advised the South African National Department of Health on their STI and PrEP programs through their membership of the PrEP and STI technical working groups. Hence, they understand the priorities of the Department of Health through these pre-existing engagement mechanisms. Our second activity will be to undertake a systematic review to establish the prevalence of antimicrobial resistance to common STIs. We are also engaging PrEP users in discrete choice experiments to understand their preferences for a diagnostic STI care. So participants will be presented with different choice sets, and the data will be analyzed to identify the top 3 choice sets. These top 3 choice sets will be presented to policymakers within these technical working groups and healthcare providers in separate focus group discussions to discuss the feasibility of implementing the choices made by the service users within the South African health system. We will explore 4 elements of feasibility, but I'll be highlighting just 2 in this presentation. The first explores the practicality of implementing the interventions into an already stretched health system, given that public healthcare facilities have challenges with client load, waiting times, staff turnover, and limited resources. Secondly, we will engage policymakers, healthcare providers, and facility managers in assessing the level of system change needed to integrate the interventions within the existing programs. So the main outcome of this exercise will be to establish a set of interventions that we can propose for evaluation in a future research. So challenges. So I traveled to South Africa at the end of February 2020 to meet with Deanta and the rest of the research team at Wits RHI. Whilst there, South Africa went into a lockdown on 26 March due to the COVID-19 pandemic. So all research activities except COVID-19 related research came to a grinding halt as the ethics committee sent out a communique that all face-to-face data collection for non-COVID research should be suspended. Following this, we adapted our research tools to support virtual data collection and eventually obtained ethics approval in November 2020. So PrEP users participating in a Unit supported PrEP implementation rollout program who are managed by the WITS RHI in collaboration with the Department of Health belong to WhatsApp support groups, which are managed by the respective health facilities that the PrEP users attend. Hence, we sought permission to post a link to our DCA questionnaire on REDCap on these WhatsApp support groups. And we've piloted this in 15 participants at the beginning of December 2020. So this pilot revealed some challenges which we're now busy addressing. So I'll hand over the rest of the presentation to Deanta, who will take over from here.
Thank you, Collins. So just regarding our outcomes, I will start with the systematic review. And we, as Collins mentioned, we are currently undertaking a systematic review to determine the prevalence of antimicrobial resistance in adolescents and in adults with respect to common STIs in sub-Saharan Africa. So we used a standard search criteria to describe that we described in 3 databases, that being PubMed, Embase, and Web of Science. And these were for studies published in English between the 1st of Jan 2000 to 26th of May 2020 in sub-Saharan Africa. We identified 263 studies, and after our necessary screening and eligibility processes, we identified 51 articles for inclusion in our narrative synthesis. So moving on to the outcomes for the DCE pilot. So the DCE pilot, we invited 15 participants to participate in our DCE pilot. And this DCE pilot is on our virtual platform called REDCap. All 15 participants completed a basic screening survey, of which 6 completed our e-consent process. Following that, 4 completed our socio-demographic survey, and following that, they completed a DCE. Only 3 participants completed the DCE fully, and 1 had a partial completion. So the pilot will help us to identify what adaptations we need to make in order to support virtual data collection for the study. We are currently working on those adaptations and will perform a second round of the pilot shortly. Moving on to the reflections. So the award has allowed us to establish a brand new collaboration between the University of Sussex and WITS RHI, and this has allowed us to have a mutual exchange of ideas in an area of common and shared research interest. The suspension of our face-to-face data collection drove innovation in data collection procedures in terms of the fact that we took advantage of technology to make our data collection virtual. This approach has now allowed us to potentially increase the reach of our research in terms of the potential participants we could reach within a short period of time. Piloting the tool has then further allowed us to identify challenges that were posed, for example, system glitches, the length of the study tools, and internet data availability. And just to highlight on these, upon review of our online tool, we determined that our audio recordings that we had placed on the tool for the informed consent and the discrete choice experiments were too lengthy and may have fatigued participants. So in order to mitigate against this, we reduced the length of the audio recordings to a maximum of 3 minutes per recording. In addition, during the pilot, we provided a data voucher of 100 Rand to participants for completion of the DCE. Upon review, we felt it better to split the data voucher. So to have a data voucher at the beginning of data collection after a participant provides consent in order to aid completion of the survey, and then a further data voucher at the end of the survey. We also highlighted that there is variable internet connectivity, and the cost of internet data could mean that some PrEP users could not participate in the survey. Regarding some considerations for future research proposal, we believe that future research study designs should be adaptable in that they should make provisions for virtual data collection, although we understand that not all studies can do this. There should also be an increasing acceptance of an e-consent as a valid form of consent. There's also a need to capacity build researchers in low to middle income countries to be better equipped to support virtual study procedures. And finally, we felt that the 9 months that we had to complete the study at the initial duration of the award was too short, as sometimes it takes up to 6 months to secure ethics approval, even in pre-pandemic times. Next slide. Thank you very much for your attention.
Thanks very much, Diantha and Collins. And again, very interesting. In fact, it's great to see this presentation because people often struggle with how to balance a health systems research proposal with a disease-specific focus. And I think you've done that quite nicely in making sure that although you start with HIV and STI, there's actually a really clear systems angle to it. So well done for that. I have several questions. Again, some of these are more generic and I'll take them up later, but there's one particular question about REDCap, which I'd actually be interested. I know the name REDCap, but I can't quite remember what it is. Can you say a little bit about what REDCap is? And also the specific question is, can you make it available to people? And I don't know enough. So one of you, who knows most about REDCap?
Diantha.
Okay, Diantha, excellent. Go ahead, please.
Thanks, Collins. Thanks, Anne. So REDCap stands for Research Electronic Data Capture. It is an online tool. It's basically an online tool that you can script, for example, surveys, you can script databases onto this tool, and it is free to use. However, it's free to use and generally attached to, for example, an NGO or a university. So it is quite a versatile tool. It was classically used for clinical trials to capture clinical trial data. I think the only, as far as I'm aware, the only condition placed by REDCap is that their software cannot be used to generate an income of any form. So it must be used in a sense for example, for research and for the extension of knowledge. So this platform can be made available. I can post a link to the REDCap consortium where our participants can get more information.
Excellent. So is this a South African development or it's come from somewhere else?
No, so it's from the Vanderbilt University in the USA,
Okay.
but it is in multiple countries. So they have much success globally.
Excellent. Yes, so please do post a link to it. So I'm sure people can find it by Googling REDCap. Thanks, Ray. So we've had the 50 minutes for this presentation, so I think we should move on, but many thanks to the two of you for another very interesting presentation. So we come now to our third presentation. Our presenters are Roman Zhu, Professor of Global Health and Health Systems at Southern Medical University in China, and Ellen Nolte, Professor of Health Services and Systems Research at the LSHTM in the UK. And they're going to talk about Everest, which is Evidence to Strengthen Health Systems Partnership. And just to note that I know that they don't have to tell us anything about COVID interruptions, which is great. So go ahead, please.
Thank you very much, Anne. So I'm going to talk briefly about the background and our general approach, and then hand over to Roman to talk about the challenges, outcomes, and reflections. So briefly, our award is set within the 2009 China Health Reform and the Healthy China 2030 strategy, which achieved quite substantial improvements in terms of access to health insurance across China, and access to a free basic public health package of care, and also a reduction in out-of-pocket payments to some degree, but several challenges remain, in particular around capacity, use, and quality of primary care, increased fragmentation of financing and service delivery, but also increased healthcare costs. The focus of this particular project is on disadvantaged populations in the least developed parts of China, which also chimes with the Healthy China 2030 strategy, which is trying to tackle those issues. And our ambition is really to try to understand how we can improve access to primary care services in those populations, with lessons within China by focusing on two of the most disadvantaged provinces, having a partner from Nepal to extend the lessons to there, but also more generally on how we can improve access. So very briefly on our approach, as I said, our focus is on access and use of primary healthcare in disadvantaged populations. We have a three-pronged approach, mapping existing research around accessing or the experiences of people in accessing services and the challenges they are facing by means of a scoping review. We have conducted site visits and community workshops in two of the provinces, in Gansu, which is one of the least developed parts of China, and Inner Mongolia, which, while not least developed, faces other challenges, in particular around nomadic populations and high levels of rurality. And both the outcomes of the scoping review and the community workshops feed into a series of stakeholder workshops, which we'll be using to formulate specific policy and health systems research questions, which we will take forward in our actual grant proposal development. And here I'm going to hand over to Roman to speak about some of the challenges and outcomes we've been experiences and produced so far.
Thank you, Ellen. Can you move to the next slide? Our activities, fortunately, has not yet been greatly affected by COVID-19 due to the relative normalcy in China. But our biggest challenge so far is me to blame, because during the course of our activity, I moved from Sun Yat-sen University to Southern Medical University in the same city of Guangzhou. And that move has led to tremendous amount of administrative hurdles on many fronts. And although we can conduct our field visits and meeting people, conducting workshops, but COVID-19 still created a barrier there. Ellen and Carol, our UK colleagues, cannot come to China, and everything has to be coordinated remotely. We are very grateful for the extension of the grant time, because we have been able to use that extension very well to do the things otherwise we cannot do in a short period of time. Next slide. Some of the outcomes, we have been able to establish our partnerships with 6 institutions. Ellen, can you please move to the next slide for the outcome?
It should be on there. Can you see it?
It is on there.
Oh, okay.
Yeah,
Okay.
good.
Maybe maybe an internet delay on my screen. That's okay. So we have managed to establish the 6 institutions. It's an interesting arrangement, because there are UK institution and a Chinese institution and Kathmandu University in Nepal. Within China, 2 universities are in the most advanced province in China. The other 2 are in the least developed development areas. We have conducted our scoping review. We have reviewed extensively both the Chinese and English language literature for the vulnerable communities for their access to care and experiences. And we found out a majority of the studies provided only indirect evidence using secondary data, and a very little study focusing on quantitative experiences of people in accessing primary health care. We have been able to conduct community workshops with vulnerable population from the villages and also the barefoot doctors. The biggest enemy for our workshop is the weather. We delayed our workshop for some days because of the heavy snow. When the snow melted away, it's still 15 degrees below 0, but we are able to come to village clinic's office, as the picture here shows. That's a stove with a coal burning, so bringing some of the warmth. Our stakeholder workshop, community workshop, have suggested that people are generally quite happy with the substantial progress in healthcare and economic development for the past 10 years. However, despite they have great amount of trust in the barefoot doctor, the village doctors, but they do not really trust much of the doctors and the clinicians in the township health centers. When they are really sick, seriously sick, they very often bypass the county hospitals and go straight to the provincial hospital for care. Relatively, they have relatively easy access to care, but quality is clearly a concern. Also, despite China has established universal health insurance, but the coverage of the insurance is still very limited. So when people are sick, majority of our participants in the community workshop expressed that they had a heavy burden financially. And then many of them have to give up follow-up visits after the hospital discharge. So financial burden is still a top burden for them. Next one. Some of the reflections. This grant is really great because it paved the way to build up this very reciprocal, equal partnership. This partnership has been setting the foundation for people coming together. Despite people of our lead scientists in this partnership coming from 4 countries, and we found out actually cultural differences is not a big issue. A commonality is more than other things, and we have nurtured a very good working relationship among the researchers. Also, China is in a transitional economy. China has many of its experiences which can be very helpful for other low-income countries. But UK has so much strength and experiences in method and also in other areas. So this very interesting arrangement of triangular relationship of the partnership is very beneficial for 3 countries. We have also been able to mobilize junior faculties from both China, Inner Mongolia, Lanzhou, and also Nepal. They have been engaged greatly to even lead some of the research activities, such as the scoping review. One of the key research need emerging from the informal discussion of our project members with decision makers is China has so many projects going on, and the grassroots level clinicians have been burdened with so many projects. So the key from their perspective is not to have too many new initiatives, but they want to get the original initiative implemented and get them done well. So from that perspective, implementation science in health system research may be also a key for future directions. So with that, thank you so much. And we're looking forward to some of the questions.
Excellent. Thank you, Roman and Ellen. And again, a comment on this presentation. I think what's on this topic, what's really important if you're the feature of the focus of your research is a relatively wealthy middle-income country like China, is to focus in on vulnerable populations and the poorest areas. And I think that was a real strength of this proposal, that it's looking at areas in China that are particularly poor and vulnerable. And I must say, we shiver in the UK, -18 doesn't really sounds very challenging, and presumably with issues of indoor air pollution as well if you're burning coal. I wanted to ask one follow-up question. So you include Nepal and you make a case for why it's useful to include Nepal, but practically, how are you going to, what sort of, are you essentially including Nepal just as part of the process in order to build the relationship for the next phase, or do you think concretely there'll be learnings from this development award between the 2 countries, and how are you going to bring them out? And maybe Roman, you'd like to respond first, and then I'll ask Ellen.
Sure. First of all, I must say, even before this, we already have some relationship with our colleagues in Nepal. So in this effort, we have purposely engaged one of the junior faculty from Nepal, and he is actually actively participated in the scoping review. So through that process, it's naturally for her to understand what is happening in China. We also engaged our Nepal colleagues in all of our conference calls. So it's in the current project, they are definitely engaged and also actively looking at what is the Chinese approach in the past 10 years in the least developed areas for the vulnerable community, and how those can be translated back to Nepal. But also into our next phase of project application, we will be consciously and actively engaging Nepal and think about the future program will not only benefit China, but also using Chinese experience to benefit other countries, particularly Nepal.
Okay. Anything you want to add to that, Ellen?
No, I think just to highlight, I think the major emphasis was really on capacity building and setting the context to then inform the next stage much more strategically.
Okay. Yeah, thank you. And in fact, while just after I asked that question, a question has come in, which I think is very relevant to this presentation. So a question that, did you feel that the discussions at community level were able to raise some critical issues? How was an open environment created that can allow frank discussions with community representatives? So Roman, I think that's for you probably.
Yeah, thank you. This is a very good question. We have benefited tremendously from this because, you know, in China, as researchers, we don't really have a tradition of engaging communities. We say we engage them in the past, but not in a serious and a genuine fashion. In my experience, this is the first time we are seriously and systematically engaging our community people. Before we went to the communities, I was a little skeptical. I thought Chinese are very shy and I'm afraid nobody will talk. But actually during our community workshop, people are very relaxed, even though many of them are illiterate, have multiple NCDs, but they can talk for a long day. And they shared so much information I would never imagine I can gain. Just one example, I always think when people have diabetes, you should improve your lifestyle. But I was not aware in this village, they don't really have a vegetable. They have no access because they're so cold and they have to go for a long distance if they want to get any vegetable. So the only thing they have is meat and the pickled vegetable. So I understand then what is our solution for those people with multiple NCDs. It's a very interesting experience.
But were people able to, or did people feel able to criticize local development efforts or
yes,
their community representatives or their village governance or whatever?
Yes, that's also actually the village doctor is so vocal about how they are being treated not so well, because they are sort of have dual roles as farmers but also as clinicians. But they said that in the past, the teachers have been treated as civil servants, but village doctors are treated as farmers, and they have no pensions. So they have lots of, they are very outspoken.
They're outspoken. Okay, that's great. Thanks very much, both of you. Okay, I think that's probably the end of your time, so thank you. And I'll move on now to our fourth and final presentation, which is by Sunil Joshi from the Department of Community Medicine at Kathmandu Medical College and Kathmandu University in Nepal, and Julie Mitten, Professor of Charter of the University of the West of England in the UK. And the title is Identification of Research Priorities for a Safe Systems Approach to Road Safety in Nepal. So go ahead, please.
Hello, everyone. Thank you very much, Anne. My name is Julie Mitten, and I will start today's presentation and then hand over to my colleague, Professor Joshi. So as Anne said, our development award was on the identification of research priorities for a safe system approach to road safety in Nepal. As an introduction, more than 1.3 million people die and more than 15 million people are injured in road traffic crashes around the world every year. And 90% of those road traffic injuries occur in low and middle income countries. The estimated road traffic injury rate in Nepal is 22.9 per 100,000 per year, which is high in Southeast Asian region. The countries with the lowest road traffic injury rate in the world, which are the Scandinavian countries, have adapted what they've called a safe systems approach to road safety. So this is a multi-sectoral collaboration where different agencies come together and all work collectively in order to make the road environment as safe as possible. The safe systems approach recognizes the fact that humans make errors, and what they do with the system is try to ensure the system will reduce the chance that an error made on the road environment will result in an injury or death. So the World Health Organization, recognizing the success of the safe systems approach, has now recommended that all countries of the world should take action on road safety across what they've called 5 pillars. And they are that countries should aim for better road safety management, safer roads and mobility for all road users, safer vehicles, safer road users, so that includes pedestrians and cyclists as well as the occupants of motorised vehicles, and having an effective post-crash response to ensure that those victims of road traffic crashes have the best chances of survival. And Nepal needs to take action across all 5 pillars of road safety in order to reduce its road traffic injury rate. So our aim was to identify what were the research priorities within Nepal for road safety. And to do this, we decided to conduct 5 Delphi studies, one for each of the pillars of road safety. So what we've been doing is we have been identifying and then interviewing about 20 to 25 stakeholders for each of the pillars of road safety, and asking them to help identify research and evidence gaps and barriers to making progress with that pillar. The issues that the participants have raised through those interviews are then collated and condensed into approximately 30 research questions, which are then shared back with the stakeholders for that group, and they are asked to rank them in order of importance. We then offer the stakeholders a meeting at which those issues can be discussed and debated, and we then invite the stakeholders to change their mind and re-rank, if necessary, a slightly shortened, already prioritised list of research questions. We plan to end our Development Award with a dissemination activity in order to be able to share the findings for all 5 pillars with all stakeholders across all 5 groups. So I will now hand over to Professor Joshi to talk about the challenges, outcomes and reflections.
Thank you, Julie. Dear colleagues, now I would like to start with the challenges. So when we started this project, you see, we never thought that there would be COVID-19 pandemic, and we were planning everything to go physically, you see. So we have expectations that interviews and meetings would be conducted face to face, but you see, due to the COVID-19 pandemic, we had to go fully online, but it was a really very good learning experience for us. And for example, you see, we're planning to have Delphi training workshop, you see, physically conducted at Kathmandu, in Nepal. And we were planning to invite retired UE professor Nicola Ramsey to Nepal, but we had to, change our Delphi training to an online course, but it was a wonderful learning experience. And also at the same time, you see, all interviews and meetings have moved online. We were really very, at the beginning, we were worried about that, but that also turns to be something, good learning outcome, you see. And sometimes people are worried about internet connections, and it really very, you see, very different times, but it was not a big issue. And as we started a lot of workshops and meetings online. Some participants were reluctant, and mainly with the high ranking government officials who are usually busy, you see. So they were initially unable to give enough time for these online discussions and workshops. So that was a challenge as well. And as Julia just mentioned, you see, we are planning to conduct face-to-face dissemination event, but we still have some time. We have planned to conduct that workshop during March, April 2021. Let's see what happens. Otherwise, we will also conduct this workshop online. So these were the few challenges we faced. And also at the beginning, we thought that it would be really a big challenge to conduct 5 Delphi studies in 9 months, but it was so nice of NIHR that and they had extended the project for 6 months as a part of no cost extension. Next slide, please, Julie. And talking about outcomes, the same, we had to recruit the researchers little bit late, so it was delayed until June 2020, and we conducted Delphi training online in July and August 2020. And as Julie has already mentioned, that we had Delphi studies for 5 pillars on road safety. And you can see that we have already completed 2 pillars, pillar number 2 and pillar number 3, and pillar number 1, 4, and 5. They are still going on. And little bit talking about the those outcomes of those pillars. Our study participants are the stakeholders. They have prioritized our research questions into top 5 ranked research questions, you see. And in pillar 2, they rank top 5 research questions, and in pillar 3, they rank top 7 research questions. For example, I would like to just say a little bit about the rank research question. Like in pillar 2, the number 1 ranking was what is the effectiveness of different safety features, you see, installed on the roads in terms of crash reduction, or what are the barriers and facilitators for achieving safer roads in Nepal. And when you talk about pillar number 3, the number 1 ranking question was something research question was, what are the factors affecting fitness condition and roadworthiness of vehicles to the extent that it leads to road traffic crashes. So they rank the research questions. Next slide, please, Julie. And talking about the final slide on the reflections, we had very good reflections. 2 female researchers conducted each interview, and initially we were a little bit worried, but online interviews and meetings, they have gone better than we have anticipated. And most invited stakeholders have actively engaged during the meetings and during the workshops. And about half of all participants, you see, whom we interviewed, attended the virtual workshops, and they participated, really very actively, and it was very productive workshop. And we think that the emerging research priorities are very helpful for future applications, because now from the stakeholders, we have got many research priorities, and we have been able to develop, you see, active stakeholder networks that gives an added value to this research. So we already have, very active networks, for example, Road Danger Reduction Forum and, First Response Group. And on the top of already developed networks, these 5 Delphi studies have, strengthened our network significantly. And we think that, you know, the process has been really worthwhile, and we have been able to, you see, gather many important research questions. And our reflection and the challenge at the same time was, you know, there were very few female participants compared to males, mainly in pillars number 2 and 3. And this has been also because of, you know, recent government transfers. For example, you know, the government agency that was responsible for pillar number 2 and 3, that is mainly Ministry of Infrastructure, Physical Infrastructure and Transport, you see, the responsible person was a female. In fact, the boss of that section was female, but she got recently transferred, you know, to another department. So we lost her, but otherwise, you see, in other pillars we had good contribution from female participants. So these are few reflections from our studies. Thank you. And if you have any questions, we will be happy to clarify the questions.
Excellent. Thank you very much to both of you, and great to end with a topic of research that is about the broader determinants of health and not just the healthcare system. So I have a question specific to you. How did you identify the stakeholders to participate in each of the Delphi studies? So,
okay.
Yeah.
So, thank you for the questions. You see, when we started the project, you see, as a part of NIHR, you know, road injury prevention, you see, activities, we develop, you see, various networks. For example, road danger reduction forum, and you see, first response groups. So they are really very active, you know, people working in the field of injury, road safety, road traffic crashes prevention. So we approach them and we ask them, you see, whom should we contact for you know, for the participation in the study. So they gave us the name of the officials and the people, you know, holding important positions in the government and non-governmental agencies. So we approached them and we got their, you see, consent, and we invited them to participate in the study.
Okay, excellent. Anything you want to add, Julie?
No, only other to say that we're very fortunate that we've got very good networks in Nepal, and we're able to get a nice breadth of stakeholders from both sort of NGO perspectives as well as sort of different levels of government. So that's been really helpful.
Excellent. Okay, very good. So many thanks to both of you. Thank you very much. And we are perfectly timed, in fact, 3 minutes early for our panel Q&A. So I already have a couple of 2 or 3, in fact 3 now questions pending, which I'll come to in just a minute. But just to remind people that this Q&A session is both on the specific presentations and on reflections of, firstly, these type of development awards and what the challenge is and what the value of them are, as well as the broader NIHR Global Health Policy and Systems Research Call and the challenges in supporting equitable partnerships, bringing in public, patient, community perspectives, ensuring you respond to realities and priorities in low middle income countries, how to build sustainable capacity, and then lesson learning across settings. So those are some of the reflections. I'd invite questions and comments in. But first of all, I'm going to go to a question of how do you go about identifying partners? So given that when you actually put in a proposal, you don't start with a totally blank slate. How did the partnerships we've heard from come about? Does anyone want, I can't have everyone speak, but anyone wave at me. I think you can all turn your cameras on at this point, and then I can see you. Who wants to respond to that? Does anyone want to step in? Who wants to? I'd actually particularly like a low middle income country participant respond to this. And I know that some of you had pre-existing collaborations. I mean, did any of you reach out without knowing who you were reaching out to as a matter of interest? Collins. Oh, so you did. Do you want to comment on it? Unmute yourself and comment. So you sent a query on the email, or what did you do?
Yeah, I already work in South Africa, but never previously collaborated with WITS RHI. I know they're a very strong institution when it comes to sexual and reproductive health research. And so it was obvious that in order to set up something along those lines, they'll be the best go-to institution. So I sent an email and got a very positive response.
Okay. Anyone else want to comment? So Maria, I was going to ask Jean Paul, but I can't actually see him on the screen at the moment.
Yeah, I was wondering as well if he's there, because
what do you
he
want
might have a good story
on his behalf. I mean, did you have a pre-existing relationship?
Yeah, so it was a bit serendipitous, as you say, but at the same time it wasn't a blank slate. I think Jean Paul and I, and also others in the partnership, had been all kind of students or very young research assistants at ITM in Antwerp, at the Institute of Tropical Medicine. So we had that link, and now we're all at a stage where we're becoming PIs.
So you were student college. Jean Paul, welcome back.
Yes, I think this is a fantastic experience of really working together, like from a childhood, I will say, in research and in public health. So we really feel very close in the way we think about public health, in the way we think about political economy and UHC. And we have been collaborating informally on several other activities. So here we are really like formalizing our way to work together. So this is like an ongoing. I think in 10 and 20 years, we will still be working on various.
And Jean Paul, I know that with your proposal, you're using the research to identify additional partners. So how did you, and particularly reaching out to some other countries in Francophone Africa, because as I've said, there's not so much engagement. It's some of the countries with least research capacity. So how did you decide of your neighbors who to reach out to and which you'd involve?
So it is a path dependency. There is something like we can use like path dependency consequences here. I think there is we have been engaged in a network called the Community of Practices. There have been various community of practices that were organized around various pillars of the health system across the sub-Saharan African region. And I think this back to 2017, 2016, and even been before back to 2012 and 13, those networks have been like sedimentally creating collaborations and form of existing interlinkages between various actors. So when I think about research in Burkina Faso, now I think directly to partners that I have met through various pre-existing networks like the Community of Practices, but also around from other researchers that we have conducted together with those actors. But it is also the place to mention the West African Network of Emerging Leaders in Health Policy and System Research. That is an ADRC supported network led by Professor Irene Ajepong that you may know from Ghana. That is a great initiative that started back to 2015. So I'm now here sitting at the office at WAHO, at the West African Health Organization. That is one of the supporting partners of this network in West Africa. So it is a very powerful network with more than 100 junior health researchers active in all the 15 West African countries. So we have a common platform, we discussed and we work together. So when I think about reaching a researcher or a practitioner in health policy and system in any of the West African countries, I go to this network and I have someone to talk to.
Okay, that reminds me, I mean, I think none of you on the panel will know this, but many years ago, there was an initiative on malaria research in Africa, which brought researchers together and which has really created put together. I mean, formerly links were all north-south, but it actually created a community of African and malaria researchers, which has been really productive. So I think that's an interesting lesson. So I'd better probably move on. So how many of you had existing links to policymakers? Is there any one of you for whom this research provided the opportunity to build links that you hadn't had before? Any of you? Or did you all of you had some existing links? Yeah, Dianta.
So us in South Africa, we do have existing links to policymakers and key stakeholders within the government, but I think research such as this has helped us to enhance those relationships. So I think from our side, I feel like it really does help us to enhance those relationships by bringing in new data.
Yeah.
So
I know in South Africa, places like WITS are generally very well linked into government. I mean, any of these institutes where you weren't already well linked in, I guess.
So I can have a comment here
Yeah.
about the political economy. So in terms of engagement with political economy actors, you know, there are many other people working on political sciences, even journalists very active in analyzing the economical context of the countries or the political context of the country. So engaging stakeholders on political economy in the region forced us a little bit to consider those group of actors who most of the time have a quite high level of knowledge and sense about the political economy drivers in our context. So particularly, there are many key actors coming from political science, economical science, even journalists working on following up political actors closely or the economical context closely, either from the West Africa region or, for instance, from France, like from a radio station like RFI, who monitor closely political context and economical context. And this project has given us the opportunity to open our eyes on the value of those persons and their production for our understanding of the context. So this is really something new that opened the eyes on all those group of stakeholders, very important for political economy, Francophone Africa at least.
Good. Okay, so I have an interesting question about within the stakeholders, what about government officials? I mean, it's often really difficult to get the time of government officials. They're very busy people. I mean, I wondered, Roman, in your provinces in Ganju and Inner Mongolia, was that straightforward, or are you not seeking yet to engage at that level? Are you more at the village level?
Thank you. I'm eager to speak because it's a half hour past midnight, so I must speak something to invigorate myself. It's always a challenge to engage government policymakers as they are so busy, no matter the higher ranking or the lower ranking policymakers. However, particularly in China, we found out for the provincial universities, like Inner Mongolia Medical University, they tend to have a very close relationships with the government. Very often, government seek a lot of consultancy from those universities. So the bond between them and the policymakers has turned out to be very strong. So as they have always been doing favors to the government. So when we are trying to do something, they do return the favors. But also, many of the government policymakers are graduates from those provincial schools. So they naturally become the allies of our study. We haven't yet had our stakeholder workshop. We just had a community workshop, which is targeting the end users and the barefoot doctors, etc. But in the coming 2 weeks, we are going to have stakeholder workshop where many of the policymakers will come. So the challenge is not to engage the policymakers from the health department, but the policymakers from other government entities like financing, human resources for health. Health, those are difficult.
Okay, Ellen, you wanted to add?
Yeah, just to add, I mean, because our approach has been to kind of, get input from the community and the scoping reviews, but thanks to the very close links of our Inner Mongolian partner, some of our focus has already shifted to implementation because they had this sort of ongoing conversation that they really want to understand the how of doing things rather than necessarily the what, because there's some awareness of some of the issues, particularly pertaining to quality of primary care and people surpassing or bypassing the township level. And I think there is this implementation element has already come out, which we didn't expect to that extent.
And Ellen, before I know, Julie, you want to speak, but let me just follow up one question with you, Ellen. I mean, from my perspective, obviously, I know you're from my own institution, but I mean, your background is research in Europe. You're by origin German. You've worked in the UK sometime, primarily on UK European health policy. And, you know, your exposure in middle income countries is pretty recent and limited. So in terms of engagement of government officials and how you do that within the context of a health policy systems research project, does it feel the same fundamentally, or is it really different? I'm curious.
I feel it's pretty much similar in terms of you know, getting the attention of policymakers. What is different, I suppose, but it depends on, because I've worked across Eastern Europe as well, I think, and this is what we discussed with Roman as well, are the kind of very subtle or sometimes not so subtle hierarchies. And we've kind of been planning around the stakeholder workshops, how do we ensure that people actually do get a voice? Because of very strong hierarchies, people at some particular levels are not willing to speak out. And we've kind of developed some approach and hoping to be able to share that in due course. Okay, interesting. Julie, you wanted to comment?
It was just an observation from our experience in Nepal. We've found that if we want to speak to a senior minister or something like that, the tendency is you may get invited to go to their office, and meeting them in their office is not always a good idea because they get interrupted the whole time. People come in asking for their signature on something or that sort of thing. So we found that if we can invite somebody to a meeting outside of their office and they come and we go to some neutral territory, often their time is a little bit more protected. And it's been it's been more valuable to do it outside of a minister's office than inside government.
And I know that pre-COVID, I mean, for example, when I was involved in research in South Africa, it was also, you find somewhere really nice to go for a day or two so that you can get the policymakers out of their setting and they're not quite so pulled away to their offices. But that was pre-COVID. And that brings me actually to a question that is relevant to those of you whose research has been hit by COVID. So there's a question about the best ways of doing virtual research in a COVID era, but I wondered, I thought I'd angle that a bit more to say, what have you learned from having to do it virtually that you might take forward even if more normal styles of research persist? So have we, I mean, like with some of our conferences and Zooms, we've discovered we can do things that we didn't know we could. Anything you will plan to continue? Who wants to say? Collins, you look as if you want to speak. Go ahead.
First, I'll start by saying I think face-to-face is always better because there are cues you can pick up when interviewing people, and you may want to pursue those cues further. But with virtual data collection, it's difficult as well, depending on sort of the population groups you're trying to reach. And there is the risk that you might end up with some selection bias because you're reaching certain demographics and leaving out others just because of access to data and internet connectivity. So these are some of the challenges we are encountering at the moment. And then with virtual data collection, sometimes people are just intimidated because they have to do like everything themselves. After the first couple of questions, like the red cap, which we floated on WhatsApp groups, it's basically all the instructions they need to do, it is embedded within it without any access to an interviewer to chaperone or guide them. But we've since learned that we'd have to build that in. And so that's one of the things that's come out of this pilot, actually.
Okay, thanks. So I see Diantha and then Ellen.
So just to add to what Collins has said, I think going to even in non-COVID times, if we are to take up this virtual data collection, we must somewhat of a hybrid approach, because I feel like you do need to see a human, you do need to interact with a human to make that process a lot smoother. So I think navigating through how that hybrid approach should look is what we'd probably take forward.
Okay, and Ellen?
I think, yeah, a lot of work is possible to do online, and I think for future awards, perhaps, we can budget for less travel, but not zero travel. What we found particularly challenging is sort of, at the conceptual stage, which is online quite difficult, where you just want a whiteboard and, just like 4 hours of protected time and just sort of write and think through. And I think this is it is possible, but it's not that effective, we find, and it just delays things a little bit more.
Yeah, it's easy.
I have a comment here.
Yeah, sorry, go ahead, Jean-Paul.
Definitely, this is the time we have to recognize the stronger added value of locally based research centers. If global health has to continue to be a powerful space of knowledge production, we really definitely need strong, locally rooted research institutions that have not only good data collection capacities, but also good analytical capacities. Definitely, we like it or not, we will have less and less and less travel over time. I think that for many reasons, either for coronavirus or not, for climate change or for various reasons, we have demonstrated that there are many things that do not require, that we can do if we rely on trusted and effective, grounded, on the ground local institutions that can carry some work on the ground, but that can also process analytically some of those data so that the collaboration ground around more analytical level and more methodological and supportive level. So one key message forward for me is that we have to invest in strengthening local research organizations. They are very passionate people who want to do research, and we have to support them institutionally, put them together and encourage them to be there on the field, so that we can build another kind of relationship with them. And this is what I found in the spirit of this ground and of this approach that is very powerful and that is futuristic, and we have to encourage that.
I mean, the critical importance of strong local institutions. Yes, Julie.
Just building on that comment of Jean-Paul's, the relationship bit is the key thing, isn't it? It's being able to actually build a trusting relationship with the people that you want to participate in your study. And I think that for us, Prof. Joshi and I were able to have worked together prior to this award, and we'd never attempted to do online interviews before because we felt that it was not so culturally acceptable, because it was almost disrespectful not to try to meet your participant person face to face. And one of the things that a real positive outcome of COVID has been the fact that actually we've been really positive and encouraged by the fact that so many participants have agreed to engage with us in an online forum. So it's almost opened up an alternative way of engaging with our participants for us that we could use in the future. We'll be able to give them more options. It doesn't just have to be face to face.
So can I push this a little bit further? Because picking up on Jean-Paul's comment, I mean, in a world where there is gradually stronger research capacity in lower middle income countries, and clearly across these awards, there's very different strength. I mean, the sort of strength you might have in some of the poorer countries in West Africa is very different from the strength that there is now in China, for example. So as that capacity gets built up, what value is there? Is there still value in these partnerships across countries and across institutions? I mean, will you ever come to a point where you essentially don't need that, or what do you gain? I mean, I mean,
this is an
I might throw out a
question.
comment of my own, which is that I always feel that in an area like health policy and systems research, we don't, it's not like a medical issue. There's no single blueprint. And often the way for one country to learn is by reflecting what other countries do. And it's a comparative analysis of why does something work in another country and not work in a different one, and what are the determinants of that. So, you know, my personal view is that one of the inherent elements of health policy systems research is the comparative one, but I'm just interested in those reflections. So even if there's similar capacity everywhere, we would still want to collaborate. And Ellen, that's the case in Europe.
Yeah, absolutely. I mean, European research, I mean, especially when we think about really rigorous cross-system analysis, you really have to have teams in each country to have the insight, not of the document, because we all know the really important stuff is that is not documented. And this is where you need teams locally to understand what is going on in order to do really better cross-comparative, cross-country research.
And of course, there's the example of the European Observatory, which has been going for a very long time and is now mimicked in the Asia Pacific, but where the European Observatory is collectively funded by governments and WHO and engages a number of research institutions within Europe. And I don't know, Ellen, that must have been going for 20 years or so and continues because of the value it adds.
Yeah, 25 years now.
25 years. Okay. Any other thoughts on this? Roman, any comments? Sorry, let me go to Roman and then I'll come back to
this
you.
This question have been asked also to the panel, to the final panel of the Institute of Tropical Medicine Colloquium of 2020. And I think it is an existential question, I think, for global health. And we will have to reinvent the way we think the global north and global south collaboration, not only for this reason of possibility that capacities will be growing almost equally. I will not say equally almost equally, but what can emerge as well is that we cannot all be very strong in everything at the same time. I think there will be some form of specializations on various dimensions in terms of technology, methodology, access to certain fields that will make us always almost dependent from each other in one or another way. I think this is also another way of looking at it. And the concept of collective intelligence, I think, is something much more powerful, something very powerful in the way we can frame this collective collaboration in the future. We will always be more powerful if we take time to listen to what the other people are doing, what they are bringing in as approach, as methodology, as way of thinking, and as experience, etc. That will create a network that with more mutually beneficial capacity. So this is, I think, another way. We will have like a puzzle of capacity. It will be more like a puzzle of capacity all over the globe. And depending on what you want to achieve, the collaboration will be more constructed in the way to enhance, to optimize the result you want to achieve by ensuring that you have a good mix by mixing capacities of partners to achieve that.
Okay. Roman, do you want to add anything on this? Yeah, and then I'll come to the end.
Thank you, Anne. I think this is a really interesting question. Even all of our capacities were the same and the skill sets are exactly the same. I still personally think partnerships will be important because we still have our perspectives. I found the perspectives are always shaped by your culture, contexts, and your experiences. I still remember when I went to Nepal, working with our colleagues in Kathmandu University, I was always amazed how they do the things for primary health care, which came back to me as eye-opening. Even our skill sets are the same. I can never think about, oh, they are doing the things in this way to linking university with a very remote outpost research center and making that work. So partnership will always be important.
Diantha.
I actually just wanted to support and tag on to what Jean-Paul had mentioned, is that the capacity building is more bi-directional and multi-directional rather than unidirectional. like if I have to just think about my experience with Sussex University and Collins, in that we as an institute with SRHI, we do have significant capacity, but what was lacking is that we did not have capacity in discrete choice experiments, which is being provided by this collaboration. And then equally, we have quite a strong capacity on REDCap, which Sussex University might not have. So the capacity building is multi-directional, and we're learning from each other as we go along. So there's many times when I actually have chats with Collins and just reflect on what he does in the UK. And I'm like, okay, that sparks another idea. So even from that engagement, more ideas start coming through. So
great. And Sunil.
Yeah, you see, my experience is, you see, on this topic at Kathmandu Medical College, my department has collaboration with many European universities, and we have many collaborative programs. And my experience is, you see, in the world of this globalization, you know, we can learn from anyone from any country, you see. The European countries can learn from the Asian countries or African countries, and we can learn as well. So there are so many rooms for knowledge sharing and knowledge, you know, learning. And so this is really very important, because there are so many things, you know, the students or the researchers from the developed countries can learn from the developing countries. And it's vice versa. So in the world of globalization, I think there should be multi-dimensional, you see, collaboration, and it should go on. Yeah.
Great. Thank you. Maria, briefly, if you may, because I've got a couple more questions now.
Yes, just to complement the point, I think from from our perspective of political economy analysis, it's interesting to see that one of the key issues that we discussed in our skill building session was that of reflexivity and the advantages and disadvantage of being insider or outsider and doing political economy analysis. It kind of also brings in, you know, links to this discussion. So yes, we have reflected quite actively on that as well.
Okay, great, thank you. So I'm just as a warning, I'm going to give up most of my final 5 minutes because I think this is a really interesting discussion. I'm going to, in a moment, ask you about your messages for NIHR on how the development award model can be improved. So keep that in your mind and start thinking about it. But before I ask you about that, I want to ask whether any of you had unexpected findings coming through your planning award that you really didn't realize you might get when you started, and that will influence your approach to the research or to the engagement. So things you didn't expect. Roman.
I did not expect the technology has penetrated so deep, even into the older people and for people without any knowledge. Because when we went, the people over 60 years old, they used to cannot do anything in the winter, but now they can use their cell phone to buy something through online shopping store. So that enlightened us to think about how mobile technology can bring some changes to primary health care.
Yeah, okay, interesting. Any other reflections? Things you didn't expect? No, nothing. We're all yeah, Sunil.
Okay, you know, something very interesting, you know, we found during this Delphi studies, mainly when we are talking about the government officials, mainly those people who are working with the implementation of policies, you see, they are so scared of research. They don't want to, you know, participate in research. And at the same time, you see, mainly people working with this planning and advocacy things, they are always very soft. They have soft corner towards research. So we have to do something. How can we make those implementers, you know, those people who are in the government, high-level government positions and who are implementing the policies? I think they should be inclined a little bit towards research, acceptance of research. You see, this is something we have to think about.
Yeah. Okay. Good. Well, thank you for that. So I'll move now to my final question, which I'd really like to hear from all panelists on this, which is, what is your message to NIHR? You can see that Val presented at the start. There are 3 calls. There's the Development Awards, the Commissioned Awards, whatever it's called, and then there's a researcher-led call coming up fairly soon. I mean, obviously, we don't yet know about funding beyond that. We're in the towards the end of a current phase of funding for this sort of research. So we don't know what will happen after that, but I'm sure NIHR would like to continue this sort of research. So specifically on the Development Awards, anything you would like them to do differently? Or do you just want to say do it all again the same way? Okay, so I saw Collins first and then Ellen.
So we already reflected on some of this in our presentations. We feel that 9 months is just far too short a duration for the call. And then if the development award is expected to feed into the researcher-led award, then with the call coming out in March, I think they overlap quite a lot. I was hoping there might be a few months gap between the end of one call and the beginning of the other, so that those results can inform the subsequent bid. So
I don't remember this. Was 9 months the term you were given? It wasn't your choice. It was what you were told that you had 9 months to do it. So Van is
yes.
Not. Yeah, I agree. I mean, by the time, especially if you, well, I mean, all of this sort of research would require ethics approval. And some countries it can take 9 months or at least 3 months to get ethics in the first place. Yeah. Okay, Ellen?
Yeah, I think my question very much links, or my suggestion links to Colin's question, because as well as shown, the award, in our understanding, was really to prepare. So it wasn't really research, but we found it really hard to distinguish what is research, what isn't research, and how much research should we be doing. And I think this links, you know, the more research you do, the more time you actually need for all these various reasons that have been raised. So it would be good to perhaps for the next generation or cohort of applicants to clarify the boundaries, perhaps a little bit more. To give some some certainty, I guess, for the preparation.
Yeah. Okay, thanks. Jean-Paul and Maria. Yeah, Jean-Paul.
I think on top of what have been shared, I think it is important to put together in one or another way, or give opportunity to the grantees of a cohort to have opportunity to talk to each other and to learn from each other on the approaches they are using. I see, for instance, opportunities to develop further collaboration later on with Collins and the team on working on sexual and reproductive health. But definitely there are possibilities to learn from the approaches and the practical way the various groups are trying to solve certain operational challenges, and there are definitely opportunities to work about that. For instance, every 3 months, having like 1 hour, I don't know, forum of the grantees can be just enough, and having access to the email address possibly, and to tap into the various capacities available within the cohort can be very also helpful.
And that's a very interesting comment, because there's quite a lot of experience in the UK with that, usually in relation to fairly specific calls where people have a lot of common interest, but also in relation to fellowships where you bring all the cohort of fellows together and interact yearly or whatever. And it's all, people always say how rich that experience is. Yeah. And as we now know, it's so, I mean, okay, face-to-face is better, that maybe, but face-to-face can be really expensive when everyone's scattered across the world. So online interaction is probably better than nothing. So Julie and Sunil, Julie?
Just to mention about the duration of the award again, I'm wondering whether NIHR might consider sort of trying to build in some flexibility with the duration of the development award, because I think it kind of depends what you need to do within your setting. So it might be that for one project 9 months is enough, but another project actually might need 18 months. And maybe there is a way of actually offering a range of duration or a range of value that gives the researchers that flexibility. That would be helpful, I think.
Thank you. So I think all the proposals, all of your projects have had a chance to speak, and I've managed to leave myself 0 minutes for my wrapping up comments, which is good, which was my aim, except that I think that, well, firstly, to thank you all for your presentations, for your participation in the panel discussion. And I think this session has shown the real strength of these sorts of partnerships. And one of the things I really took away was the value of these networks in health policy and systems research, whether they're intercontinental networks or whether they're continental networks, of bringing people together and allowing lesson learning and allowing identification of common interests. So that's been really helpful. I don't know, Val, you've been sitting there listening. I don't know, you want to respond to any of that or just to go straight over to Sarah, but I think my job is done. So thanks very much.
I need to say thanks so much from me, and yes, let's hand it over to Sarah. Thank you all.
Okay. Thank you, everyone. I'm just trying to find my slides to share. Right, so thank you, Anne, and thank you, panelists, for such a fantastic session. I think it's been really, really interesting, and also for the feedback, because, you know, we are here to listen and to take note of the findings. Actually, there we go. So this will inform the future planning for our awards, and if there are any further comments that you want to make in the discussion forum or the Q&A, please do, because we would like to pick them up. And as a consequence of this session, we'll be developing a blog, or Val will be summarising the session, and we hope to get that out early next week. But in the meantime, if you want to keep in contact with us, please do sign up to our Global Health newsletter. I've put a link in the discussion forum. Follow us on Twitter for the latest things that are happening. But also interesting to think about the community of interest and how we can try and keep that conversation going, because we do have a community that we started at the very start to help us elicit what these awards should be, and that's our Global Health Policy Systems Research Slack channel. But actually, maybe there's more that we need to think about in terms of that going forward. So just to alert you that we are indeed planning the next call, and we will be evaluating the success of the development awards as well as they come to a conclusion. So this next award is likely to launch in March this year, and the timescale will be that it will close in July. We had intended that there would be an overlap, but we may go away and think about how in the future we can make that a better thing for the development award holders. And the outcome's likely to be in November 21. So for more information, please do keep a lookout on our website. But we don't just have health policy and systems research calls, which has been the focus of today, but we do have open calls for our research units, the groups, the right call, and the centres, and they're all currently open on our website today. But equally, the next call launching will be March for health policy and systems research. So I think that really leaves me a chance to say a huge thank you to Anne for chairing the session so brilliantly, and for each of our speakers for contributing. And to thank you very much for, I think, the really valuable, interesting learning that has happened across the whole of the awards that we fund. And it's given us some really good takeaway messages, I think, particularly around timeframes for these awards and the challenges around ethics approval, the differences that you all achieve, you have when you set out in terms of the contextual challenges and perhaps the flexibility that you might need in those awards. So I think thank you all so much, and do look out for the blog, which will be coming shortly. And I think that's it from me as well. So thank you all for attending. The one thing is, I did look at the polls, and there seems to be some interest in the awards coming forth for the future, but also some helpful focus on what is challenging in terms of community engagement and how you approach these awards. So we'll be taking all of that away and putting it into our blog. So thank you so much, and a round of applause to everyone for participating. Thank you.